November is Lung Cancer Awareness Month, and chances are you may know someone in your life who has been affected by lung disease or lung cancer. And we're lucky enough to have one of the best lung cancer programs with world-renowned physicians right here in our own backyard at Corewell Health. Dr. Gustavo Cumbo is a pulmonologist at Corewell Health, and he's joining us via Zoom to talk about lung health and treatments and for someone with lung cancer, what that looks like. Joining us. Thank you so much for joining us, Dr. Cumbo. How are you today?
Thank you for having me. I'm doing really well. How about you guys?
I'm feeling great today, but these stats that I was looking at earlier were kind of astonishing. I had no idea that lung cancer had surpassed breast cancer and prostate cancer. It really is the leading killer.
It's very unfortunate. We have a big problem in this country. Lung cancer is the second leading cause of death in the United States. And the reason for that is only surpassed by heart problems. When you take a look at cancer, lung cancer kills more Americans than breast, prostate, and colon combined. There's 240,000 new lung cancers a year and 130,000 yearly deaths from lung cancer. So unfortunately, among smokers and non-smokers, there's 1 in 16 chances of an American having lung cancer.
That's incredibly stark numbers. You're talking about 250,000 people a year. What I'm assuming, we just had the national smoke out. I'm assuming lung cancer, the #1 problem here is tobacco.
You are absolutely correct. At least 8 out of 10 lung cancer are due to first-hand tobacco use. But that's not the only reason for somebody to have lung cancer. There's less patients that have lung cancer and never smoke. And it can be either environmental exposures, sometimes genetics. And we have at Corewell Health an excellent group of clinicians, nurses, surgeons that we have a really good program for detecting this early and saving as many lives as we can.
And I'm assuming that means early detection, as in most diseases, is key.
Absolutely. Unfortunately, lung cancer is one of those very aggressive cancers that 4 out of 5 of these cancers get diagnosed in a later stage when surgery to cure a patient is no longer an option. Therefore, for the past 10 years plus in the country, we have lung cancer screening in which patients between the ages of 50 and 80 that are current smokers or recently quit smoking, they can have a yearly CAT scan. And we can see if they develop a spot that could potentially be a cancer. And I'm going to tell you that the programs that we have at Corewell are really patient-centered and tailored to tell each patient what do they need in order to know what the next step is in their care.
Yeah, you might want to consider putting that lung cancer screening as part of your annual visit with your physician to get that on the calendar. But over the time lately, it seems as though with these increased precise diagnosis and treatment that's happening at Corewell, that the outcomes have been improving.
Absolutely. So this is the one thing that it's important for our West Michiganders to know is that we are people just like them. We're here to help out. We are not judgmental. We expedite care. We want to make sure that the care that we provide is tailored to each patient's need. From the time that the patient is referred to Corewell multidisciplinary team or lung nodule clinic, we are able to tailor all the needs to what patient needs. Now, let's say that the patient gets a CAT scan and they has a spot. We are known for being the best program for minimally invasive biopsies when we use robots to diagnose lung cancer or lung nodules or infection. So we are doing research and trials for artificial intelligence to help doctors make decisions for patients. We have very minimally invasive options for patients to know and not having to get cut open, no bleeding, same-day procedures. We have expedited the way for patients to be able to be seen here by expert doctors that this is what we do for a living. So we provide true value care with excellent outcomes. We benchmark against everybody else, and I'm pleased to say that we are second to none. So we're waiting for patients to come and check us out.
I'm so glad that we have you right here in our backyard to have such a fantastic facility waiting for us. Thank you, Dr. Cumbo, for the time this morning.
I appreciate the time, and everybody stay safe there.
Thank you so much, Doctor. Thank you. Lung Cancer Awareness Month, Corewell Health. You want to learn more? SpectrumHealth.org for the info.